Have you ever had shoulder pain, neck pain, carpal tunnel that just isn't going away? Well, good news for you. Today I'm going to talk about trigger point therapy injections that can help to resolve or kind of take it to the next level of pain resolution. Hi, I'm Dr. Angela Yeagley. Welcome to Sage Health TV, and today I'm with Barry Napier, who is our Chief Marketing Director, and today is also my lovely model that I'm going to be demonstrating on, and patient.
Do my best today to be at service.
Does a great job. So trigger point therapy, essentially, I'm sure you've heard of knots, right? Like, oh, I have a knot. Yeah. You probably have one now. So we're gonna find out here in a second.
Have one.
Yeah.
I have a shoulder issue that always comes creeping up, so this is a good one for me.
Okay, yeah. Fantastic. Okay, so most people are like, oh, my knot, right? Like, oh, it's killing me.
Would this also be like a neck pain, like if you sleep weird and you wake up and there's
Absolutely.
like that localized pain kind of,
yeah.
like, oh, or the tweak?
Yes, and a lot of times that's centered around a trigger point, but it also can be spasm as well, right? So they usually go together. So now what that is essentially is kind of the trigger point. Most people can feel it, right? They're rubbing, they're like, this is a knot, right, in my space, in my muscle. And what that is a combination of lactic acid buildup, and it's become a little calcified too. So the body, in response to pain, right, and stress, localized. Yeah.
Builds like a little fortress around it almost, or
exactly.
something.
Yes, the fortress. And so what our goal is, and this is any therapist, like if a massage therapist is working on you and finds that, right, usually they put pressure on it, they're trying to break it up, so we're going next level, and what we're doing is we're injecting a combination of lidocaine. We add a little B12 in there for healing, and then we follow it actually with a type of oxygen, and that really opens up like that cellular healing, and the body uses that oxygen just to kind of, again, push that lactic acid out.
Bring new blood flow, nutrients in.
Exactly. So today what I'm going to do is I'm going to use Barry to show you kind of the points that you might not be thinking of, like if you're having neck pain or upper back pain that really need to be addressed. So how about we start? I'm going to have you turn around. Okay, this way. Okay, so for the neck, actually, so a lot of people when they have neck pain associated with headaches, a lot of times it starts kind of back in this area. So we get back into the upper cervicals, right? This is like kind of like your C1, C2, and on down. And then gets into the occiput, so right into this area, and then also the occipital ridge. And so actually what we do, because many times people have they'll have tightness here, and then they'll get pain that radiates all the way over to like the top of the head, is we actually will inject. We're going to get up here into this occipital ridge, and it's a tiny needle, so don't freak out. Super, super tiny, but enough to kind of just get in this area. Then also going to inject right in here, so you can feel this on yourself. They feel like little bony ridges, right in this area. And then along with this tiny needle, these are called the cervical paraspinals. And so we're going to go right in this area as well. So here, and then we have coming up, we've got the traps and the levator, right? So now, actually, Barry's doing pretty well. He's got a little bit, I don't know if you feel that. It's a little bit. Yeah. And then right here, so he's got a couple trigger points. Actually, he's doing pretty well. I would say he's doing better than I am at this point today. But so say these couple, I would get into the trigger points there, we'll go along here, and then the trap specifically, you have to kind of raise it, and we're going to get like a little injection right into this area, and that's also the levator. So on both sides, you want to do it. So even if, say, you have like a right-sided pain, we always balance it out. And the reason why is because when you release and you relax one side, the other side starts to compensate, right? It's like you start feeling this all of a sudden. You're like, I didn't have any left-sided pain, and now I do, right? Now I feel it. So, but actually your left side, so actually this is also, like for you, I would say maybe this is actually a little tighter, right? Yeah, that's a little worse. So for then a lot of people to have pain here, so again, the trap, levator, and your rhomboids, right? And so we want to get into actually inject here and the thoracic paraspinals, or what we call them. So, and that's a lot of times we have to incorporate the traps as well, right? And sometimes we'll do a little bit of that lower neck. So if there's no neck pain really, and there's no radiating headaches, right, we'll focus on this area. And many times, again, so actually for you, like a little bit here coming down, but not too bad, right? A lot of people have a lot of what we would call those trigger points or knots right here, right in the rhomboid. So
a lot of that from desk work.
Exactly. Yeah. So, okay, I'll have you turn around. All right, so let's talk about the shoulder. So, again, usually I would say shoulder is probably many times from injury, right? You know, having like rotator cuff injury, or like overuse of something like through some activity, right? And so, same thing, depending on what you're dealing with. There are a lot of components to the shoulder, right? Like if you're dealing with some sort of like bicipital issue, we're going to be like injecting all along here, right? Kind of getting into the bicipital, around the bicipital tendon, right? And then same thing, like for rotator cuff, combining all of it, we're doing the delts here, and even getting into like some people have subscapular, so you actually have to get up into this area as well, like you have to inject, which is also, and hope somebody's not ticklish, right? You're like, so, and then again, you know, because all this is associated, if somebody also has these things going on, you have to do all of it, right? It's that whole connected thing.
Like how many shots are we talking about?
So usually for the first time, I minimize it, right? Because you can trigger point somebody, and then it makes them flare. And so usually if somebody's really needle cautious, or again, they're very sensitive, then it might be like, okay, we're doing one on each side, and then here, right? And so it just depends.
Got it. Okay.
Yeah, but sometimes we do more than that, especially if the person's doing okay.
I've seen these needles before. They're very small.
Very tiny.
You can't barely feel them.
Yeah. We do have larger ones, and sometimes we do bust out the larger ones.
If it's like a really concentrated,
deep, and that's where a lot of times we'll need that for the lumbar paraspinals, because they're so thick, and deep, and they just go down. So last one, if we're dealing with like a carpal tunnel. So this is really interesting. So we always think of it like as, pathology is here, right? Like, so we have basically the sheath that comes over and that gets kind of inflamed. And a lot of times what you have to do is you actually have to treat, you have to go and do all the extensor muscles up here. You have to inject them. And then strangely, the points that you want for this are up here. Like, so you inject through, and every once in a while you do get into the hand as well. But the hand is super sensitive, and so most people, they only want like one of those, and you're avoiding the sheath. That's why we go above, we go here. So like if you've ever had a massage therapist, and actually Barry has a little bit of this right there, like you just have some tightness, right? Doesn't mean that he has carpal tunnel, but it just means that, there's some areas that probably could be worked on or massaged, right?
A lot of computer work.
Yeah, a lot of computer work. Yeah. So really you're treating more the arm, right? It seems like you're treating the arm, but really you're just opening, because especially in men, like these are so tight usually, right? And sometimes the carpal tunnel can just be from nerve impingement because these muscles are so tight.
Interesting, yeah. Further up the line, basically.
Exactly, further up the line, and then you get in there and you release it, inject it, and follow it with that oxygen. The oxygen's amazing, it goes everywhere, and then all of a sudden it's like, oh, the hand is better, I can use it.
And is it one time, or does it typically require like a few treatments?
Yeah, it's a few treatments. Okay. Sometimes, every once in a while, somebody can have one, and then it's like...
But like most stuff with kind of muscle tissue, it seems like there's a few treatments you have to go through to get it.
Exactly. Yeah. So I would recommend, usually I say at least two, because really at that second one, if you're like, oh, that it's not helping, then we know maybe that therapy is not for you, or we need to do something else. But usually it's going to work for most people, and we want 3 or 4 treatments. So you just you just plan on that. And then we do it in combination with, a lot of times, send it to my favorite holistic chiropractic group, you know, because if your neck is out of alignment and like you're also like the spine is out of alignment, your hips are shifted, like, you know, in certain areas, you're going to keep putting strain on those muscles. Like if your hips are rotated, right, then it's going to pull on your low back, which then travels all the way up. So
the body's like a little bit of that interconnected,
yeah,
right? So typically if you have some stuff showing up, it seems like, especially with going to see chiropractors in the past, over at Head to Toe, we love those guys.
Love those guys.
Shout out. But it seems like that you have to kind of solve the whole thing.
Yes, you have to, right. It's always, and then we, you know, from basically what we do is we're going to also work on then like your minerals and increasing your magnesium and then just your overall like vitamin C is necessary for connective tissue repair and
supporting kind of the internal state, like the internal biochemical state.
Exactly. And sometimes we will reach for those higher dose. Like if you've had a lot of injury, we might do like a high dose IV vitamin C because of all that connective tissue repair, and then also like, you know, encouraging collagen and bone broth and those other things.
Glutathione.
So, we just did a video on glutathione, and it's great. We're having a little bit of an obsession with glutathione right now. Super antioxidant, really incredible for everything. Unfortunately, we do not inject glutathione into trigger points. Right. I don't know. Maybe it's a research study we should start exploring. Who knows? Maybe that's the missing link. Yeah. Right. Well, thank you so much. Please reach out, you know, and like and subscribe below, and definitely let us, if you're experiencing any of these things, you know, love to put together a comprehensive plan for you anytime. Okay. Thanks for joining us. We'll see you next time.